Welcome to the Healers Café, conversations on health and healing with Dr. Manuj.
So welcome to the Healers Café. Today I have Dr. Manuj Nangia and then a PA, which is a physician assistant, Melissa Smith. And Dr. Manuj is a psychiatrist. And let me just give you a little bit about his history, and I'm going to ask both of them to speak a little bit what they do. But he is the CEO and medical director of the San Jose Integrative Wellness Center, and his specialty is addiction medicine, behavioral health, and wellness. So I think we have quite a lot to talk about in this day and age, especially with the pandemic going on. And I've been really looking forward to having this interview with you. So I think I'm going to hand it to you first. And if you could give us a little bit more the context. You've been in practice, I think, 13 years. What led you there to start with? And yeah, tell us a little bit about that.
I guess it could be a long story, but let me do a briefer version. I started out with a behavioral health mentor as I left a fellowship at UC San Francisco to study under David Burns at Stanford. And so that's why I began my psychiatry career doing therapy along with medication management. And over the years, I've been guided towards doing more medication management. I've decided to stick with taking insurance. And this is a dilemma with many doctors in most fields of medicine, perhaps if not all, that we have a limited time frame where we will get reimbursed for seeing clients. After 20 minutes, we don't get much more reimbursement. And so when I would do therapy, when I do therapy, it's more on it's more contributory towards helping someone and maintaining my skills as a therapist when I do my hour-long sessions. So it's taken a shift towards almost exclusively medication management, and what can I do in that limited amount of time with my clients in those 20-30 minutes I get with them to affect them as much as I can as on a more therapeutic level, and also assess them during that time. And so that's been my journey, and mostly I've been seeing people that are highly functional working in Silicon Valley. So people who are brilliant working at these companies, and also healthcare providers, their family members. That's mostly the population that I've been serving. People with stress from work, relationships, most common what I see. And over the years, I've seen how important wellness is, and not just for them, but for all of us, because, therapists, we talk amongst each other too, and just seeing that doctors are, on a large part, not living exemplary lives of wellness, even though we're seen as authorities on wellness. And so part of what I do with students is, Melissa is graduating soon from Yale, a wonderful university, as a PA. And they get 4 weeks of behavioral health rotation. And so I try to give them 4 weeks of wellness. And the question I ask myself is, how can I impact them the most in those 4 weeks to whichever field they decide to go in? It can increase their own wellness and what they contribute into the world of wellness and more holistic evaluation of their patients in our field. So yeah.
So what I'm hearing you say in this case too is that the constraints of the system make you basically manage drugs, but the needs of the patients are larger than the management of drugs alone. There's a bigger need for more time, which the current structure of the system makes it very difficult. And so when you're training, you're hoping to get the emphasis or the understanding of the wellness component, which you have found important. Am I understanding that correctly?
No, just one difference, which is management of people, whole people versus management of drugs.
Yes.
I know our training is geared towards the deductive reasoning and differential diagnosis, and then we weed it out and find that diagnosis, and then we look at symptoms, and we're trained to use medications to treat those symptoms, to get rid of symptoms. And so in treating the whole person, right? This is a shift that I know medicine's going to be making, and I'm just contributing towards that shift, which is focusing more on their wellness, optimal living versus deductive, getting rid of depression. How do I get more wellness in my life, and what's blocking me from there, and how to do that in a limited amount of time.
Yes. No, I was trying to emphasize the limited amount of time.
Yeah.
Where, because it's in integrative types of settings. Yeah. Obviously you can have like a naturopathic doctor deal with nutrition, because obviously nutrition impacts your gut health, impacts all of your mental health as well, right? Yeah. So the thing is, yeah, you really need a bigger team, but then it leaves you with managing drugs, because most people are not in a position to manage drugs, and so many people are on so many drugs. When I started my practice in Nova Scotia, people were on like 8 to 10 drugs, and at that time they didn't even have in the pharmacies, they had no way of knowing if you wanted something, you could go to a different pharmacy down the road, because there was no centralized records whatsoever, right? So people were on contradictory medications for their general health, but psychiatric health that they had, like it was really crazy to see how it was just left completely open and quite dangerously. So that was my experience. So I'm really glad to see that I think you're right, that we are towards a trend that there has to be complementary connections between what we eat and, the context of our wellness, the context of health, and what are our support networks. All of that absolutely matters to a patient. So, Melissa, I wanted to ask you, what is your experience so far in your studies, and then coming into practice? What are you seeing or observing?
Well, PAs are generalists, and so our training is 13 different rotations in all the different fields of medicine, and then we have 3 electives. So right now I have the good fortune of working under Dr. Nangia, and so in my behavioral medicine, as he said, it's 4 weeks, and it is very short. A PA education is a very quick education. Our program's 2.5 years. So I've seen a little bit of a lot of different things. And what you guys are speaking to, as far as, the focus on medication management and the time spent with patients, and how the billing and just this system is set up, not to point the blame at anybody, but it's difficult to envision, which I had the ideas going into PA school, of being able to treat the whole person and do exactly the things that Dr. Nangia is trying to do in his practice. And so it's definitely been an honor to witness this, that it actually can be done. And the struggles that you go through, and how the staff works together to accomplish this. And even if daily you're faced with the challenges of billing and the amount of time that you're allowed to spend with patients, still looking to treat them as individuals, and to come up with treatment plans specific to them. And I think part of that is seeking a balance in our lives. And that's something that Dr. Nangia's Wellness Center really focuses on. I think a big key to our health is balance, you know, whether that be work or life or spirituality or all the different factors that we consider important as humans. And something we're facing now, of course, with the pandemic, you know, being able to be social creatures is something that's, we've had to rely more on technology for that aspect of our lives. But I have seen some incredible, amazing things in my education that have just touched my heart. How doctors such as Dr. Nangia, PAs and NPs that have precepted me have worked with patients and helped patients. And that's one of the reasons I wanted to be a PA. Was so that I could make a difference in people's lives while also supporting my own life and my family's life. And so, yeah, my education has been very encouraging and heartwarming. And I haven't chosen a specific field yet, but definitely behavioral medicine is near and dear to my heart because I was worked in corrections and mental health for about 9 years. And so, yeah, that's something that I'm familiar with, and that even in my personal life, I have a very strong interest in evolutionary psychology. So,
so what got you? Because part of what I'm covering in this podcast is what brings people into this healing, you know, profession on what levels, or what was it for you that started this whole journey?
well, I served 10 years in the military as a medic. And it was kind of a natural transition for me to go into PA. That's kind of the expected next step. And I would love to stay a medic, but the civilian equivalent is EMT. And I just wanted to do something a little differently. So PA sounded like the right step for me. And doing a career later in life, considering doing a longer education that an MD would require, is something that didn't sound as reasonable to me at my age. So the shorter education and the continuing of my current path in the military, and as far as being in the health field, you know, there's all these reasons that we have for why we want to be in the helping field, and specifically medicine in our lives. I had a mother that passed away of cancer, and my dad had many years Parkinson's, and just taking care of both of them is that also brought the field of medicine closer to my heart.
Wow. And what about for you, Dr. Manuj? What was the inciting, and then we'll talk about balance, because I'm very interested in what you have to say, but what was the thing that brought you into this field?
You know, I don't really know, to be honest. I had a vision of it since I was little. My parents, unlike some, you know, Indian immigrant parents, mine didn't really push any particular field. Maybe that's why I was more open toward it. But as I got older, I also saw that there were some practicalities. I loved the sciences, and I didn't want to be a researcher. And I don't know how much of it was compassion-based, to be honest. I know that some of it had to do with, I decided that I'm going to do this, and so I'm going to do it. And I wanted to be a heart surgeon. That's what I wanted to do all the way until my third year of medical school, when I did 6 weeks in LA County General Hospital of trauma surgery. And at that time, I didn't want to do 5 years of surgery because my life went right before my eyes, and you know, I was not sleeping. This is right as they were limiting the hours to 80-hour work weeks. It was almost the same year that they started limiting that, and so people weren't even following it. And so, yeah, I'm not really sure how the journey got me here, but yeah, I'm glad I'm here now.
Yeah, clearly. Well, I mean, everyone has their journey, and thanks for being so transparent about it. But for a psychiatrist to go into integrative wellness, what was there? what happened that made you realize that we need a bigger perspective on health and wellness? Like, were there people that you helped that you realized that there were limitations, or what was the thing that made you realize we need to have a bigger balance, a bigger view?
Yeah, since I was in my residency at USC, LA County, I saw a big emphasis on medications, and that the faculty were getting sponsored by pharmaceutical companies, and they were coming into our schools and giving us these lunches. And, I think common sense showed me that there's bias in how we're practicing, and there was not that much support on the therapy side and how much therapy was learned. It was very didactic versus experiential process learning. And that's what made me shift to work with David Burns, who's just a great teacher and just brilliant therapist. It was all hands-on. It's like learning basketball by playing basketball versus reading about basketball. So everything changed. And I think that's how I started my career, was questioning. And that question led me to go and try something, and then seeing, and the results just were spectacular. And that same went towards alternative and complementary medications. I had another mentor at Stanford, maybe because I was so close to a learning hub. James Lake, who's really, someone who's been leading our field in integrative, psychiatry as a mentor early on. So I think a large part was influenced by questioning, and then finding mentors in those realms, and just the influence I got from that, and the doors that opened up and what I saw.
Yeah, no, I do agree. It starts with questioning. The question is, how do people start questioning? What do they need to see?
Yeah.
What is it that makes you become, what I would call a critical thinker? Critical not being negative, but critical asking questions, so that we don't just take the status quo as the absolute given, and that really is a paradigm shift, and to dare to see something you're unfamiliar with, and see with open eyes whether it has benefits or not, and just to come in as what's the expression in English, like a learner, like a child, with what is that called? There's an expression, child's mind or whatever.
Beginner's mind.
Beginner's mind, that's what it is. Yeah. And I think that's very much needed, So let's talk a little bit about balance. Can you explain what you mean by balance from your field? What does that mean for the client, for the patient?
I guess then we're going to be going towards what wellness is.
Sure, absolutely.
And so if we're looking at our lives as a whole, we have different parts. We can break it up. And how do we break it up and quantify it? And if we do it ourselves, what are we likely to be missing? There's actually measurement tools now in our culture of measuring and data that have been validated on what is wellness. And, the World Health Organization defines it as complete physical, mental, and social well-being. So if we're shooting for optimal wellness, optimal physical, mental, and social well-being, how do we break these components up into smaller parts and check for it? So I actually use a scale, and we use it for our staff and the clients we're doing therapy with, to find parts of their lives that they might be missing on. There might be humor scores are low, or leisure scores are low, or spiritual scores are low, not getting enough sleep, nutrition. And so it helps us figure out by the person. And then with everybody I see, whether it's medication management or therapy, I inquire about the different realms, and then I spend more time on one realm that I suspect to be low for somebody. That's how I work it.
Okay, and so have you, from your experience with this, has it impacted the amount of medication that that is so-called needed by these patients? Like, have you been able to, by suggesting that they look at their nutrient intake or their sleep or their social support systems, have you seen that it can impact the need for as much medication as they may have originally been on?
Yeah, and that's probably one of the most important aspects of having students come in. Most medications in my field are prescribed by primary care doctors, SSRIs, and having students see a more integrative approach where a person's having symptoms and the process of working through those symptoms to see, are we going to use medications for it, or are we going to recommend other avenues for that? And so, yeah, definitely there's an impact on the amount and number of medications we use by using this approach.
Mm-hmm, mm-hmm. Yeah, and again, it's not. I'm definitely not pointing fingers at individuals, or it's a systemic problem. But most medical doctors have like 7 minutes with people, and it's like, here you go. Not There's no time to find out about everything else, and so they have symptoms that qualify for this in the Merck manual, and off you go. You're going to take this. And if things get worse, we're going to, then refer you to a psychiatrist, which usually means more drugs, right? Maybe different drugs, but there's really a gap there that I'm seeing from so many of the people I've seen that have gone through that route and have not really had their fundamental wellness looked at, their bigger picture, right? It's like, it really is like drug pushed. And I think if you look at the infrastructure, as you mentioned too, it's who's funding what, who's funding the schools, who's funding the programs, who's funding, the lunches and the lunch and learns, and I think it is a systemic, bigger problem, which this pandemic is definitely pointing. We have issues, clearly systemic issues, and I think as much as it has a major impact on people, on the personal level, I think as a system approach, it will force fundamental changes, hopefully in the right direction. And do you have any comments, either of you, on that statement, or anything to share?
Yeah, Melissa, what have you seen in the past, several months of doing your rotations? Perhaps if we focus on the mental health side, or you can just in general, how symptoms are managed, chronic health conditions, just what's your experience?
I think my experience has been varied, but just to take some specific examples, I was able to do part of my internal medicine rotations with the site that also does integrative wellness, and they do functional medicine and also nutrition. And in that setting, when clients signs up for a functional medicine appointment, they have an hour with the doctor most times, and then half-hour follow-ups. But when they sign up for a regular traditional Western medical appointment, they maybe have 15-20 minutes with the doctor. And the nutrition is about the same as the functional medicine. They can have an hour, and then the follow-ups are about a half an hour. So it seems like the time allotment is more when you go to a more holistic approach. But also finding insurance payment for that type of time being spent is difficult. And but it was still encouraging to see that there's a clinic like Dr. Nangia's that is combining all these factors of the wellness for the patient and doing individualized treatment plans. I know that we've done all the different settings. So as far as emergency medicine or internal medicine or pediatrics, I guess it depends on, and I've done it in different states as well. So it depends on kind of what your peers are doing and what insurance will pay. But I think it takes having this being important to you and really believing in it, and just kind of standing up to the system and finding ways, being creative to make that happen. I mean, doctors still have to make a living. This is their job, and there's nothing unethical about that. And so being able to make money and provide for your family and pay off student loans is valid, and it's important. And treating the patient as a whole patient and giving them the time that they need. You know, there's creative solutions to these problems that we face, and I think they're important ones that we face them.
Mm-hmm, mm-hmm. Yeah. So, like, I mean, a big part, and I totally agree, you know, after all the training, everyone needs to be paid for what they do. But can you foresee, or do you have thoughts, either of you can answer, you know, how a better system could be set up so that, you know, the findings that you have in your experience of wellness be more easily integrated and manageable financially? You know, how do you see any bigger picture for the world that could put all of this together, you know, a true collaborative approach?
You know, what I'm doing with my kids is I'm trying to influence them at a young age to have the practice. We have Google now, right? So we can get information, we can learn things so quickly and so easily. There's a negative part of that is the instant reward we're getting used to. On the other side is we have the ability to start growing into, there's a term, expert, a generalist expert. So becoming a generalist knows a little bit of a lot of different things. Mm-hmm. An expert knows a lot about one thing. Mm-hmm. So why not be someone that knows a lot about different things, about nutrition, about fitness, about relationships, about, you know, our psychology and you know, our chemistry, our neuro, and so practitioners, I think, and kids, we can start the process of questioning and finding things we're interested in, and then exploring and learning. And in the field of wellness, there's so many different aspects to it. Mm-hmm. And you know, how much nutrition do doctors get in medical school? It's known we get very limited mm-hmm. education on nutrition. Mm-hmm. And so with that limited, if all we have is a tool of medication, and that's what we know about, the biochemistry and the tool, how often are we going to use and implement some of these other healing strategies for our patients? So doctors becoming, you know, generalist experts. And so we lead the way by doing it ourselves, mm-hmm. by talking about it, and perhaps by modeling it, others might be interested in doing the same. Mm-hmm. And we have something at our practice that we do it. We be the wellness. We be the person that we want our clients to become. So we practice the wellness, and have students make that a priority when they're here. Is their priority is to practice wellness over anything else as a part of their 4 weeks here.
Mm. Yeah, no, that's wonderful. Yeah, because I know there was a time you would go to your doctor and they would be smoking. There's even commercials, Camel, you know, cigarettes recommended for the T-zone. I don't know if you remember all this, but it was definitely in my generation. And you know, they would be obese, and exercise was not a thing at all, you know. So it's interesting how, you know, definitely modeling the behavior is a huge influence. You know, when your doctor is actually more healthy than you are, you're like, what are they doing, you know? So and I think as parents for your children as well, and it's not just the physical health, it's the mental, emotional health, the relationship health, you know, how you are in community and in communion with other people, you know. So yeah, no, it's a very interesting. I when I did my journey, I was actually accepted both in medical school and naturopathic school. And I decided to go into naturopathic school because our training is similar in the sense of the pathology, the physiology, the anatomy, all the basic sciences and that understanding. But I found that it gave more breadth of solutions and more insight into wellness. So we do understand nutrition, we do understand psychology to a point. Again, we're not specialists of any one part. Homeopathy, all these medicines that were sort of put down generally by the press because there's a lack of understanding of the way research needs to be conducted, which is another thing. That's a whole paradigm shift. But it gives you that generalist and the ability to refer and collaborate with people. But I feel like it's so important to go through this like sieve of wholeness before going down. It's like, I keep saying this, if you go to a butcher, they're not going to tell you what vegetables to eat, unless they're a fan of great cooking, then they might put the two together, but they're going to tell you which cut of beef to buy, for example, right? So I think we definitely are at risk with the way, at least in the Canadian system, the way everything goes to specialists before really having a full understanding of the whole person, So how in the States, because you're both in the States, how does the payment structure work for, for seeing a psychiatrist, and also so that you can extend out to this wellness approach on any level of funding, or how does that work?
So you have a health condition, depression, anxiety being the most common. Mm-hmm. You see a psychiatrist. I take private insurance. The most common ones, Blue Cross or Cigna, United Health, and so you have a copay that you pay. So patients will pay $20 a visit. Mm-hmm. And we do about 45 minutes for a new patient intake. And for the patient, it's just it's one fee that they usually pay. Sometimes they have a high deductible. And when they go out of network, most of the times it's going to be cash. Insurance won't cover it. But many doctors are in network. For psychiatrists and mental health, most of my colleagues are not in network. So there would be cash. And most of my colleagues who are therapists are not in network, so they would have to pay cash, which gets expensive. Sometimes $600 an hour for a psychiatrist, $200 an hour for a therapist. And so, in mental health, people who have the money, they would see somebody who is a cash provider, namely because they usually have more experience or more skilled. And that's just, it's like there's things we don't talk about, but this is just the way it is. That's the way it is. And, I think it's almost like if I'm going to see a therapist that takes insurance, I don't know what kind of quality, therapy is like art. And how do I know how good they are? We don't really have outcome measures that track that. And so, it's kind of, that's the way the system is right now. And, we're trying to do something about it, several of us, and we'll see if that changes and how that changes in the future by tracking outcome data.
It's interesting. You raise a really, the outcome. That's the thing. It's very interesting because we have results of, double-blind, or evidence-based drug results, but that translates completely differently in practice.
Yeah.
Right? You're not just a doctor going, here's your drug and off you go. We expect the same results. It changes by everything, the encounter, everything affects the impact of the drug. Right. And none of that is measured. Right. And if you think from a science-based perspective, that's crazy.
Yeah.
Everything must be. And then they could see that there's actually a lot more that goes on than the drug itself.
Yeah. More and more of us are trying to track outcomes, and we're basically doing it ourselves. I have my students play a big role. Melissa's been playing a big role in that we're trying to collect data, and our clients rate their mood, anxiety scores every session, along with their different stressors and some of their wellness scores. And so we're trying to correlate variables with outcomes. And the students are also inputting the meds they're on and the dosages. And they're also inputting side effects. So what are the real rates of side effects of Prozac causing weight gain or sexual side effects? And how effective is Prozac versus exercise in helping improve this person's outcome? And or spiritual scores. And so we're collecting data, and it takes time to put it together. But students like Melissa are just doing a great job in this, so I'm in the process of that. Some of my colleagues are in the process of doing something like this. It's just a matter of time until the pharmaceutical industry does no longer have control over the data. We have large amounts of data out there. How do we collate it and put it together and give it to the people so they can see for themselves what are these numbers, and unpublished versus published studies, and the ethics on how these studies are done. Is that the standard? Is the double-blind placebo control? And what if we just collect a large number of outcome data and see for ourselves what's really helping people?
Well, it's funny because my background is law, and and I'm thinking like it's informed consent. Like, what is truly informed consent when what you're relying your information on is so limited? It's like, not only are you not told about other things that may help you, because not by what do you call it? It's not personal. It's just that if you don't know, you don't know. If you haven't researched anything else, you don't know that there's maybe other options for people to help. But it really begs the question of informed consent. How much does the public really, how much should they get to know, and how do we control that whole part so that it's not a one view and one perspective, the one that has so far all the financial backing, because we all know money is not a problem, but it's a problem if it's the only way we can get information, and back things up to understand one specific perspective, right? So that's very interesting what you're doing. That's great. Have you talked about that so that other people feel inclined to follow suit and get results based rather than just,
Most of my colleagues I spend time with are more on the therapist side, and we have similar training, and they do outcome measures for every session that they're with somebody. I also have a colleague who I'm close with who started a clinic for children, and he's actually creating an EHR that does outcome data measurement. And so, most doctors are you can say, working really hard, and at times the burnout rate is high, and we're pushing through that burnout rate. And so there are outcome measures. In general, what I'm seeing is just not so organized, and it's not used optimally. And we're in the process of trying to figure out how to optimally use it as well. It's just no,
it's I think that's actually pointing to something that sharing that you might get people that can put this together and see this, because I think it's so relevant, to be able to share. That's true experience, right? It's true outcome. So I think that's wonderful that you're doing this work, and it's really hard as a practitioner to do all parts. It's in fact impossible.
Yeah.
So anyway, so it's really great, Melissa, that you're helping in this project. And I'd love to get more people to understand the importance of this work, and how to put this forward. I do think as a collective mind, things will come up that move this project forward. So
Well, it's definitely a wonderful opportunity for me as a student. I've only had one other rotation where they conducted research, and I think what Dr. Nangia and what you were talking about, modeling the behavior in yourself and with your employees and your students, I can vouch for the fact that definitely our personal wellness as students is paramount. It's a huge factor in our rotation. And I think the research that he's doing is extremely important. In the other rotation that I had, they actually had their own research center that they were setting up. And then there's also the issue of financing that and the staffing to take care of that. They set up a foundation so that they could have donors, so that they could have funding for these things, and to have the outcome data, the evidence-based medicine to support diet and lifestyle changes and alternative therapies like homeopathy and herbal remedies and so forth. We don't have the EBM for that, and I that's also near and dear to my heart, that we go towards that. And I think modeling and getting the evidence is the two really important things that you both have said. And the financing is an issue. I mean, I struggled 2 months at this other rotation because basically it was not covered, mostly by insurance, was not covered. And so people of high SES were able to access these medical services. That was an integrative wellness center. And on the one hand, that just is the way it is. And on the other hand, I think, okay, to the future, people that have money can participate in this and get the evidence, so that hopefully in the future, people that don't have the economic means can then have insurance help or some sort of government help, where they could, if we have the evidence to show, look, this works, then people without means could have access to the same medical care, which they don't now.
Exactly, yeah. And the net result of being healthy is totally worth it in society as well, for the benefit of society. It's not just a individual, I'm healthy, but it's like, I can then contribute more. I can, it has far-reaching implications, because we have so many people, who are off work or so sick at work that they're not being productive. So even from the purely like financial perspective, looking at all of this is really important, because I think this can positively change the world, in the sense of we can really learn, and that will impact future healthcare in a possibly in a very positive way.
I agree.
All right. Well, I think our time is up. So thank you so much for agreeing to do this, and we'll be in touch. Thank you.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.